If you've ever wondered why you feel a highly specific type of fatigue, a random localized pain, or just a bizarre heavy sensation in your limbs, well, traditional Chinese medicine actually offers a pretty fascinating answer. Welcome to this explainer. Today we are decoding the internal engine of the human body and the vital substances that literally make us tick. Here is our roadmap for today. We'll be covering 1. The 3 vital substances, 2. When qi goes wrong, 3. The flow of blood, 4. Body fluid imbalances, and 5. Restoring your internal harmony. Let's kick things off with Section 1, 3 vital substances, the body's engine. So I want you to think of your body like a highly complex, well-oiled machine. In this system, there are 3 fundamental vital substances, and their quality, quantity, and movement quite literally determine whether you're experiencing health or disease. First up, we have qi. This is the vital energy driving all transformation, movement, and warmth in the body. Second is blood, or shui, which provides that deep, essential nourishment to all your organs and tissues. And third, we've got body fluids, known as Jin Ye. This encompasses everything from tears to synovial fluid, basically acting as your body's vital coolant and lubricant. When all 3 of these are abundant and flowing smoothly, you experience perfect health. But things do go wrong, which brings us to Section 2, when qi goes wrong, focusing on energy imbalances. Because qi governs huge bodily functions like transformation, protection, holding, and warming, any disruption here leads to a really wide range of functional issues. According to the pathology, there are 4 primary ways your qi can malfunction. Number 1, it can be lacking, which we call qi deficiency. 2, it can get completely blocked and stuck, known as qi stagnation. 3, it can dangerously give out, which is qi collapse. Or 4, it can actually flow in the absolute wrong direction, known as rebellious qi. Let's contrast the extremes here for a second. On one end of the spectrum, we have qi deficiency. You know that sluggish feeling when you're just incredibly overworked? That leads to general fatigue, spontaneous sweating, and a weak voice. But if that exhaustion goes completely unchecked, or say there's sudden trauma, it plummets into qi collapse. Now, this is a critical, life-threatening emergency. The body's energy drops so severely it causes sudden weakness, incontinence, freezing cold limbs, and profuse cold sweating. It requires immediate intervention to rescue the yang and restore consciousness. Now, when we look at the movement of qi, things get even more specific. Take qi stagnation. This means the energy just isn't flowing freely, and honestly, it's very often triggered by emotional stress. Instead of a sharp pain, it feels more like physical distension and a deep emotional constraint. You might find yourself irritability, sighing a lot, and a practitioner would feel a distinctly wiry pulse. Rebellious qi, on the other hand, is energy literally surging backward. Think about it. If your stomach qi rebels upward instead of moving food downward, you're going to get nausea, vomiting, or chronic belching. Or if lung qi rebels, you're looking at coughing or asthma. All right, moving on to Section 3, the flow of blood, looking at nourishment and circulation. Blood can actually suffer deeply from temperature extremes, totally disrupting its ability to nourish. Let's look at blood heat first. When excessive heat enters the blood level, maybe from a febrile disease or extreme emotions, it violently agitates the body. We're talking nosebleeds, early menstruation, or sudden skin rashes. But what's truly fascinating here is that because blood anchors the shen, or spirit, blood heat can actually cause severe mental agitation or restlessness. The treatment? You have to cool the blood. Now, look at blood cold. Cold does the exact opposite. It contracts and congeals, slowing your blood flow down to an absolute crawl. This causes freezing limbs, dark menstrual clots, and these incredibly sharp pains that are miraculously relieved the moment you apply a warm compress. Beyond just temperature, we also have to look at volume and flow. Have you ever felt dizzy right upon standing, noticed extremely pale lips and nails, or maybe suffered from dry skin and insomnia? Well, this signals blood deficiency. There simply isn't enough blood to moisten your tissues or calm your mind at night. But compare that to blood stasis. This is an absolute structural roadblock in your circulation. When blood stagnates entirely, it creates a very specific type of pain. It's sharp, fixed, and localized, literally a stabbing sensation. A practitioner will observe purple lips, a purplish complexion, and a purple tongue that's often covered in small dark spots. To treat this, practitioners have to vigorously invigorate the blood to break up that stasis. Next up is Section 4, body fluid imbalances, covering moisture and regulation. Our third vital pillar relies heavily on the spleen, lungs, and kidneys. The most straightforward fluid issue is simply not having enough of it. We call this fluid deficiency, or Jin Ye. This is often caused by severe bouts of vomiting, excessive sweating, or prolonged fevers that literally just burn off the body's moisture. The result leaves your entire system dangerously parched, showing up as a dry mouth, dry lips, and scanty urine. And if it progresses to a deeper yin deficiency, a person might experience emaciation and this very specific, intriguing symptom called five-palm heat. It's a feverish, hot sensation localized right in the palms of the hands, the soles of the feet, and the center of the chest. But what happens if fluids accumulate pathologically? Often derived from a damp environment or a weak spleen, you get a condition called dampness. Now, patients suffering from this don't just feel tired. They describe a profound, sluggish heaviness in their limbs or head, almost as if they are completely wrapped in a heavy, wet towel. Clinically, you'll see a thick, sticky coating on the tongue, cloudy urination, poor appetite, and what practitioners actually call a slippery pulse. It's this turbid, lingering pathology that can be incredibly stubborn to clear out of the body. And if that dampness is allowed to stagnate even further, it can pool as clear, thin retention of fluids, or it can congeal and thicken into turbid phlegm. Now, here's a key insight that distinguishes TCM from Western medicine. Phlegm isn't just the mucus you cough up. It is a systemic congealing of fluids. It can lodge in the joints as nodules. It can obstruct the heart to cause dizziness, or even create bizarre sensory symptoms like a phantom lump in the throat that you can neither swallow nor spit out. Historically, this is called plumpet shi. Finally, if fluid accumulation becomes widespread, it manifests as oedema, causing generalized swelling depending on whether the lungs or kidneys are failing to regulate the water passages. Which brings us to our final part, Section 5, restoring your internal harmony, connecting the dots. Diagnosing an illness in this system is just such an elegant, highly logical, step-by-step process. First, they observe your symptoms to identify exactly which vital substance is impaired. Are your symptoms pointing to a lack of energy? That indicates qi. Is there a lack of nourishment or a sharp fixed pain? That points to blood. Or is it a moisture issue, pointing to body fluids? Second, they determine the exact nature of the pathology. Is the substance deficient, stagnant, too hot, or rebelling? Finally, they trace that specific malfunction right back to the responsible zung fu, or internal organ system. For example, if you have blood deficiency, they might look to strengthen the spleen, because the spleen is responsible for extracting nutrients from food to generate that blood. It is a beautifully interconnected way of viewing human health, really showing us that our energy, our circulation, and our hydration are deeply reliant on one another. So as you go about your day today, take a moment to listen to your internal engine. Based on that random sharp pain, that afternoon fatigue, or maybe that sudden feeling of heaviness, which of your vital substances might be silently crying out for attention right now?